Using AI responsibly in mental health care is not just about the technology itself. It also depends on how well people understand its limits, risks, and responsibilities.
Introducing AI in mental health care does not remove professional responsibility, but it changes how it's exercised. Clear guidance on appropriate use is essential, and this includes knowing when an AI tool might be helpful, when it should not be used, and how its outputs should be checked. Having this clarity protects both patients and professionals.
One of the first things professionals need to consider is data protection and confidentiality. Personal health information is especially sensitive, and not all AI systems handle data in the same way. Before using or recommending an AI tool, it's important to understand what data it uses and how that data is stored and who can access it.
Professionals also need to consider whether someone could be identified through the information that's being shared. Convenience or time saving does not remove professional responsibility for protecting data.
For example, while generic AI tools such as Copilot or ChatGPT might appear helpful summarizing clinical notes, using them in this way may breach data protection rules.
In other cases, how data is used may not be clearly explained. Some well-being apps sell user data to other companies, and by signing up to these services, people may be agreeing to the sharing of their personal data without fully realizing what that entails.
Transparency also matters. Professionals should have a basic understanding of who developed an AI tool, what it was designed for, and whether it has any scientific or clinical evidence behind it. Some AI tools are marketed as well-being or lifestyle products while implying mental health benefits. These products may not be regulated for clinical use. Knowing who a tool is designed for and why it exists helps ensure AI is being used appropriately and ensure decisions are based on evidence rather than marketing claims or user reviews.
Professionals also need to be aware that AI systems can reflect human bias. Because these tools are trained on historical data, they may reinforce existing inequalities or perform less reliably for certain groups, such as people with minority backgrounds or with communication differences. As a result, AI outputs should always be checked carefully rather than followed automatically.
Responsible use involves noticing when an output feels inappropriate or incomplete and knowing when to rely on professional judgment instead. This makes safeguarding especially important. AI tools may not reliably recognize distress, risk, or crisis in the same way people can.
Professionals need to think about what happens if someone discloses something worrying while using an AI tool. Is anyone alerted? Can a human step in? Understanding these processes for escalation and support are essential before using or recommending AI.
Another important issue is the extra work AI can create. Some tools require training, changes to how people work, or ongoing monitoring. If the time, effort, or support needed to use an AI system is greater than the benefits, or if not everyone has equal access to that support, choosing not to adopt an AI can be a responsible decision. Using AI responsibly means thinking about whether it's proportionate, not just whether it might save time.
Finally, it's important to reflect on the limits of the tool and the limits of our own understanding. Knowing when to ask questions, to seek training, or to avoid a tool altogether is part of responsible practice.
Before using an AI tool, professionals don't necessarily need to understand the technical aspects of the model in detail, but they should be able to answer these questions. What data does it use? Who can access the data? And what happens if something goes wrong?
AI can support mental health care, but responsibility remains with people. Safe and appropriate use depends just as much on human judgment, training, and oversight as it does on the technology itself.